My name is Jeremy Teoh from CUHK Medicine. A doctor's life is a long career. So you need to study for 6 years to graduate from medical school, and that's only the beginning of your career, really. And then you have 1 year of internship, and then you try to find a job, be it a medical or surgical field or other fields. And then say for surgery, then you have 2 years of basic training and then 4 years of more advanced training. So in total, you have 6 years of training before you take the fellowship examination. So 6 years plus 6 years before you become so-called a specialist in surgery. I usually encourage our junior colleagues to really try to do some research work when they are young. Although it's quite tough at the beginning of their career when they have to be on calls and all that, but then I feel that is also the best time to learn about research work. Hopefully, within the first few years, as you publish more paper, then you will be able to learn about the techniques and also the methodologies in doing research work. You prepare yourself basically to become an independent researcher. So I guess most people will still go for a usual track, meaning medical degree, fellowship examination, and then that's really the point where you want to decide for a professorial career. Then when you are like me, assistant professor, then you can do a part-time PhD or MD. So that's the time when you can work on things in parallel, I would say. So in general, does it help? It does, but perhaps you need to think whether you want to do it in sequence or whether there's a possibility in doing it simultaneously, which is kind of a balance between what you can learn and what you want to pay in terms of time. Yeah? Although I kind of emphasize it's tough, but you have a lot of satisfaction from your work. And I think being a surgeon in particular, when you can provide a cure for a cancer patient, and I think the degree of satisfaction is overwhelming. There are things that you cannot control, and that things can happen. And in surgery in particular, the worst thing that can happen will be mortality, meaning that the patient cannot survive through the surgery. But if you ask me, the most memorable incident probably is when I was a trainee. We operate on a patient with kidney cancer, and the surgery went well. Unfortunately, there was some bleeding after surgery, and we tried to go back into a theater, try to correct the bleeding. I think we went inside for 2 times, and eventually the patient didn't survive. But why it was very memorable is because when we explained to the patient about what had happened, the patient's son told my senior during that time. I was just a trainee during that time. And he said, "Doctor, although my mom has passed away, but I want to thank you for what you have done for the past weeks." It's a very broad question on what types of research we have in surgery, but in brief, there are basic research, basic science research, and then there are really clinical research. I would say for basic science research work, it would take a long time from the initial thought to the delivery of the results. For clinical work, it's more translatable, meaning that, say, for example, for a surgeon, a patient with a cancer, you want to see whether one type of surgery is better than the other type of surgery. It's my great pleasure to be here because, you know, I really enjoy teaching my students and getting them prepared to become doctors, and you all are students as well. You all are our future doctors, hopefully.